I am in awe, and I'm usually not speechless by far. So to know that you guys have, and I keep saying it, but you guys are doing tremendous work. I mean, and that, as we talk about medication and some of the side effects and all of those things, especially for people with disabilities, even going to the doctor for a doctor's appointment is not an easy road. I remember those times of going to the doctor, coming home with all these papers, and got no idea what they meant or what part did I need to read, what part can I throw away, what part was crucial to, me taking medication. Was it specified that I must, eat it with applesauce or eat it on a full stomach or, things like that. So to know you guys really sound like a strong support system for people to be able to make those phone calls and to make those initial reach outs. And as we talk about support, you mentioned something called open enrollment, which we really want to get into that conversation. But can you explain what the open enrollment is, um, and what it is and when does that happen?
Sure. So the open enrollment period takes place every fall between October the 15th and December the 7th. And it's a period of time when patients who are in a Medicare environment have the ability to change their Medicare programs. For us, specifically the Medicare D program, which pertains to the drug utilization. Now, patients have this opportunity. They have to be, sort of, I guess what I would call flexible in looking at the drugs they're taking, the drugs that they take all the time versus the ones sometimes. And they have to understand the parameters of the program because it does change from year to year. What is also different from year to year is the companies that will administer medication coverage for patients. So some years there's a lot, some years there's less, and the parameters tend to change. So the open enrollment period starts on October 15th, which is tomorrow, and it will go until December 7th, basically the end of the first week. So it's really, it's right around 7 weeks generally each year. Sometimes it extends if it happens to fall on the weekends. But, it really is important for patients, especially those using medications, and a lot of them, to look at this. Now, there are patients who are covered by Medicare and Medicaid, what we call dual eligible, and those patients can actually change more frequently. So for patients who are dual eligible, they can change for the most part every month. So if there's something dramatic that's changed in their medication utilization or their healthcare, they should always think about their coverage and keep an eye on what is their availability in terms of programs. What we have done specifically is provide an information guide for them. So we take the opportunity to log on to Medicare. We feed Medicare all of the patient's prescriptions right from our database, and we provide them with a report that shows them all of the programs that they're eligible for. And from that point of view, we explain to them exactly what the parameters are. And I'll give you an example. So traditional Medicare D, there is the premium, and that's the money that you spend out of pocket each month. Then there may or may not be a deductible. And a deductible is what you spend up front at the beginning of each year to engage your coverage. From there, we have copays, and then we have other terms like the initial coverage. Then we have what we call the coverage gap or the donut hole. We've heard about that before. And then there's also the catastrophic portion of the coverage. So in each case, the patient's out-of-pocket expense is different. So it's really important for them to see that spelled out in an apples to apples mechanism for each of the programs that are available to them. The Center for Medicare and Medicaid Services has determined that only 2% of patients choose the program that's actually best for them. So whether it's because the premium or the deductible or the coverage, it's very important for patients to get help with this, because I got to be honest with you, engaging Medicare and the Medicare website can be very, very daunting. It can take a long time. It can be a little bit confusing. It's not always the easiest system. And just to be totally honest, there's millions of people that are doing this all the time. So sometimes, just like at Christmas time, when you're trying to use a credit card machine, it can be a little bit slow because there's so many people. So what we basically do is use a series of different web services and subscription software systems to aggregate the data from our own computer system, send it off to Medicare, and provide a consolidated report for the patient. And then if they have any questions, we can provide them that guidance also. We don't choose their program. We don't guide them or lead them in any way, but we give them the information to help them make their own choice. And we do this every single year at no extra cost.
Wow, wow. So, you mentioned you guys get a report and you lay out all the information for both plans or whatever plans are available. And then the consumer has to choose, based on the information provided. Um, so when it comes down to an individual choosing that provider, I know you guys don't lead in any way, but what are some things that a person may want to consider?
Okay,
Um,
it's the best question you can possibly ask. So here's a perfect example. Your premium is the one thing that you have to pay every single month. So if you don't use many drugs or you use none, you still have to pay your premium. So that's a perfect example where you have to think about how are my dollars best spent. If I don't use a lot of drugs, if I'm not a person that needs a whole lot, I may want to consider a very low premium, even if it has a high deductible, because I'm not likely to use it. However, if I use a lot of medications and I'm in a cash flow, I'm in a balanced cash flow budgetary situation, you may find that putting out the first $475 because of the deductible may be difficult for you in a particular month. So you have to be wary of that. Then what you need to look at is what drugs am I taking? Is there a particular drug that is either not paid for by my program or requires a prior authorization or has a particularly high copay? So what you may want to do is look at a program that pays for that drug and maybe provides you with a little bit different expenses in other areas. So really it becomes a balance of how much do I want to pay every month? How much do I want to pay in terms of my deductible before I engage? What drugs are covered? What drugs are covered that I may not need, but I've been sick before? And I'll give you an example. People who have COPD, who have breathing problems, may or may not be using an inhaler all the time. Well, some of those drugs are very expensive. So if you use them often, you need to know that ahead of time, if it's covered and how much you're going to pay. If you don't use them that often and you say, well, geez, you know what? I've done really well. You may want to not worry about that as much as say something that would be for your heart or your cholesterol or your diabetes if you have those problems. So for people that are on a lot of medications, it really breaks down to what is my total out-of-pocket expense? Because that's the other dollar value we talk, it's called true out of pocket. And for some people, that's the most important thing. How much am I going to spend through the year? And the other thing is, what is the access? Is it difficult to get, is this particular program only taken by a couple pharmacies? Or is this program limiting the number of medications I can get? Does it not have this feature or that feature? So it really becomes very, very individual. But in a grand sense, it's how much do I pay a month? How much do I pay in deductible? Are my drugs covered? Is it difficult to get drugs covered that aren't with a prior authorization? And we can provide guidance for all of those issues. And to be very honest, we'll do it every single year because everything changes.
I know we're talking about pharmacy and medication, but it's almost like people need you around when they're like buying a car or buying a house, or
It's kind of like that medication, yeah. Yeah, I mean, we don't do cars and houses, but it's definitely important for medication, for sure.
It is because you know, typically, again, I can speak from experience. Typically, I won't change, because it's easier to stay with the one that you already got.
Sure.
But now that you mentioned it, that you guys do a report, and I don't have I don't have a thing where I have to use an inhaler all the time. But when the weather changes, wintertime is coming, I need my inhaler.
Sure.
So when I look at the cost, it's like, man, maybe I should have switched providers. But I say that to say this: if I got someone there to run that report, present me with the options for that year. Then I'm able to make something we call informed decision.
Educated decision. Absolutely.
Um,
The
um,
other thing, Emmanuel, is that if you have an inhaler on your profile that's particularly difficult, you may find there's another one that's preferred on your insurance program that will work just as well. And that's some of the other guidance that we also provide. Once you're on a program, say it's out of the open enrollment period, we can also help you make decisions, or at least give you information to talk to your doctor about when it comes to maybe an alternative. Because sometimes, I'll give you an example. So you're on an insurance program, a particular inhaler is preferred. Well, next year that may change, the formulary may change. So the question becomes, does it matter? It may not matter. You may find there's something else that you can use that would be less, and we can help with that also.
wow, wow. I know you guys. I know you guys been around for a while, and you kind of zoned in on, making this thing fully accessible. So I know we shared a lot of information today, and we have some other videos coming as a part of this series, called Medication Made Easy. But how can someone get in contact with you guys? And before you answer that, can you also share how someone can become part of your service? How can they take advantage of your service? And, what's the qualifications? How easy it is to kind of switch over to you guys to get that support that you guys do so well.
Well, we try to make it as easy as possible for our patients, Emmanuel. So, we're certainly going to share how people can get in contact with us, and how they can become our clients and join our community. But the first step is contacting us, and then one of our customer care representatives will walk the individual through the process. And again, taking insurance information and some patient history. And once we have that information, then we can contact primary care physicians or cardiologists or endocrinologists or whoever else is part of this individual's medical team, healthcare team, and and their current pharmacy that they use, and have everything switched over for us. It's a very, very easy process. We estimate that in most instances, the call could last anywhere from maybe 10 to 15 minutes for us to fully onboard a patient and get everything ready for them.
Wow. Well, and before you share your contact information, I know accessiblepharmacy.com is one of the most powerful ways to contact you guys, and I'll let you share that again. But you mentioned something earlier about how some pharmacies or some may not accept certain things. So I imagine you guys would accept whatever ones are available that year.
Well, we make sure that we accept any insurance program that we're able to. There are closed networks. We understand that. Some patients who are, say, retirees of a particular company or municipality may have an in-house
Right.
System, but we don't shut the door on anything. So there will be times when, specifically something is more preferred, but, in the Medicare environment, we have a Statue of Liberty mentality. We take everyone who wants to come, and we're happy to help no matter what. So the other thing is that what is maybe a little different about us is that the level of accessibility and the level of service or otherwise that we provide is a value add. There's no extra cost for anything that we do outside of the medications and the health necessities that patients would like. So if it costs $1 or $2 more just because it's, we're out of network or otherwise, what patients will get for the time that we give them and for the services can't be measured in dollars, because everything that we do has been designed specifically for patients with disabilities in the blind and low vision community. And that's just not something that, we've seen as readily available.
That being said, the information, right? The consultations, education, educational videos, the different level of packaging that we offer, very competitive prices for vitamins and supplements that can also be folded into the medication management system chosen by the patient. As well as fairly robust reminder systems. Again, these are all value adds. Our patients are not paying any more for these services. It's very important that they understand that.
Wow. Wow. Again, you told me you guys been around for a long time, and I just wish that I knew about you guys sooner. Because
well, we're here now. We want everybody to know now. To be honest with you, like it's been a lot of research and a lot of work and a lot of integration of technologies and clinical professionals and accessibility professionals. So the one thing that we're certain about is that we are going to deliver quality, and that's not something that you can rush, and it's certainly not something that you're going to what's the right word to say this, wing. You know what I mean? So we put a lot into this, and we're certain that we're going to be able to help a lot of people.
So if somebody is watching this video and they are like sitting on the edge of their seat and they're like, I need to get in contact with Accessible Pharmacy because I love what they do. I love that they can give me a report about what options are available for the year. I love the fact that they have a prescription refill guidance before I run out of my refills. If this person is anxious about contacting you guys, how can they do it? How easy it is to get a hold of you guys to start that initial conversation, to officially make the switch over to becoming a consumer for you guys?
We make it as easy as possible and offer several ways for them. They can reach us through social media on our Facebook and Instagram page, and arrange to have through those our social media to have a customer care representative contact them. And of course, there is our website at accessiblepharmacy.com.
And there's a phone number, 215-799-9900.
One other thing, Emmanuel. Anybody who has an iPhone could just ask Siri to call Accessible Pharmacy, and they will be connected.
Really?
Yes.
I almost want to try it live on this video, but I won't because Siri doesn't always listen to me. But I'm gonna give it a shot just so I know it works. But I'll do that offline. But again, thank you guys for sharing such a great information. I'm gonna make sure that all the information that was shared, as far as contact numbers, websites, I'll make sure all of that is in the description of the video for those that are watching on YouTube. This will be shared on Facebook and also our Instagram. I want to take a moment to thank you both again for joining me for one of many episodes to come within the special series of Medication Made Easy. This one wasn't, of course, in regards to open enrollment and really telling people who you guys are and what you guys do. But we have some other episodes that we are ready to go and look forward to bringing. I want to thank my people on YouTube for watching. Make sure you share this video. Subscribe to our channel so you never miss an episode. And also leave us a comment. Perhaps you have a question that we can relate to Accessible Pharmacy, and just perhaps we might get an answer back. So, again, you'll have all the contact information to do so. I hope that you will join me again for another episode right here live on YouTube. Thanks, everyone. Have a great day.
Thank you.
Thank you, Emmanuel.
Good, thank you.